Hey, what's up everybody? Bdf 44 coming at you another video. All right, I've been up since what, 3:50 this morning. I ain't been this tired in a long time, man. Did my psych eval this morning, got there on time. In fact, I got there about 30 minutes early. Did all of my routine, was able to comfortably do everything, but getting up at 3:50. I actually rolled out of bed at like 4:04, but I initially got up at 3:50 and did not fall back asleep. Been up ever since, man. I am not happy about that. I don't do that. I did get to sleep like around, what, 9:45, 10 o'clock, somewhere around there. But my body is dying right now. My head is like, I could literally lay down and go to sleep right now. But yeah, man, did the psych eval, and boy, was that frustrating. They gave me so much paperwork, so many different surveys with the same stuff on it, a bunch of memory tests. It was a lot, man. It was a lot. And we'll have the results on Friday and see what the heck we're dealing with. But for the meantime, I'm just gonna go home and try to stay awake long enough to eat and do all the normal stuff that I normally do, man. But I tell you, I think what I probably need is about a 3-hour nap. Get a 3-hour nap in and be up fresh. That's probably how this is about to go. Get up at like 9:30 and just do everything I would have did if it were like 6:30. That's kind of what I may do when I get in the house. So yeah, man, that was tedious. That was a lot of work, a lot of, you know, they're trying to get an understanding of not only what's wrong with you specifically as to what your problems may be, but also trying to throw a lot at you and see how you handle it. So he gave me like, it had to be at least 50 pages of surveys and questionnaires, and how would you handle this if you were a child versus how would you handle it now, and it gets to a point where you become mentally fatigued at the questions. Yes, no, circle yes, no, that kind of thing. And it's a lot of memory stuff, whole lot of memory stuff. And you know, say these numbers backwards, say these, I'm gonna give you 10 words, recite them all to me. Now I'm gonna give you another 10 words. Now tell me which words were in the first list and which were in the second list. It was a lot of that type of stuff. That's not, my brain sucks at all of that, you guys. I'm gonna be honest with you, my memory is awful. I thought it was better than it was, but it ain't that good, man. But you know what? It was like a stint in time, maybe like 6 years ago, when my memory had gotten really well, because I was doing the list, the prayer list, and I was reciting all those names every day. So my memory had gotten stronger that way, but I stopped doing that exercise about 1.5 years ago, and my memory is bad, man. It's terrible. So I'm pretty sure I'm below average in that, in those tests. But yeah, man, it was a lot. It was a lot. I'm not gonna lie to you guys. Threw a lot at me, but I really enjoyed sitting down with Dr. Aguilar. Shout out to him. He's really good at what he does, man. And I won't have to go back down there for the results. We can do that via FaceTime or whatever the equivalent is for their company. So I'm gonna have that appointment at 1 o'clock on Friday. Looking for the email, should be here any minute. Talk about that. And yeah, man, very accomplished. I'm glad I was able to get that done, get there on time, especially given the schedule and how I wanted to do it. As far as how I was going about the whole morning, I was wondering if I was gonna be able to pull it off. I had my alarm set for 5, but I knew that wasn't gonna be enough time to do everything I needed to do. So, you know, it worked out, man. Worked out very well. And that's really what it is, man. Hopefully that information can, the data can be sent back to my therapist, and then hopefully we can come up with some sort of diagnosis or some sort of plan as to how to go about my circumstance a bit better. But I think we learned a lot, but there was still a lot of stuff left on the table. Now it's what time is it now? It's 5:35. I think I walked out of there at like 4 o'clock. I walked in there like 8:30. We worked the whole time pretty much. We took like maybe 3 5-minute breaks. That was it. No lunch, and I didn't need it. I told him I didn't need no lunch. I just want to make sure that there was absolutely no reason for me to come back down here. He was like, we could, you know, this is running longer than I thought. We can have you come back. I'm like, nah, let's get all that done now, man. Throw all of it at me now, because I am not doing this twice. It took like, after I got off the train at Civic Center, which is downtown, you get on another bus and ride that out for like maybe 15 to 16 stops. So it took a total of probably like 2 hours to get there. Like I left the house probably like 6:30, 6:25, something like that. Got down to the train station by 7:05 or something like that. So from the time I got to the train station to the time I got there, it was like 8:30 when I arrived. So it wasn't that bad, but man, it was a lot of work, man. I'm telling y'all, it's a lot of work, bro. Like I'm as fatigued as I am off of not sleeping, I'm equally as fatigued at all the stuff that was thrown at me. Just all of the paperwork, all of the different questionnaires, all of the tests, and then just you know, kind of fatigued off the strength that I didn't perform well on them tests either. A lot of memory tests, I did not perform well, so that was kind of a drag. Just understanding like, yo, I have some real weaknesses, and they were pretty much on display. But this is what it's about. It's about getting some clarity on one's mental health, and you know, getting evaluation of not only one's mental health but also one's cognitive abilities and different things like that. And I don't know if they're gonna test the IQ. I don't think that was part of it, but it was a lot of stuff there that was done to try to kind of measure out a lot of different aspects of one's brain. So yeah, it was a lot, and glad it's behind me, man, to be honest with you. I don't care to do that again. I sat down with him and talked a little bit about different things, but it wasn't really a therapy session. It was strictly evaluating the brain and how it works, how it functions, how it doesn't, weaknesses, strengths, and an emphasis on memory. And that was just, that's tough to do when you're already sleepy, that kind of thing. But you know, I managed it, and looking forward to the results and seeing what comes of it. So yeah, man, that's really what I have to say about that. I'm very thankful for just the entire process being completed, and having been able to address it head on. Say I now have done one. I have done a psych evaluation, a full one, as an adult, and I think he was able to help me in some areas, because he also talked about some of my medical stuff. I told him about what I've been struggling with physically, and he said, yeah, you know, you got to get you to a doctor. I may be able to help with that process. That's what Dr. Aguilar was saying. He said I can probably help with that. There are some things that I can do, send some recommendations to your therapist about some things. Maybe we can get you set up with some other avenues for your situation. So that was really helpful. Sit down with Dr. Aguilar. And so yeah, man, that's really what it is. I don't really know if I have it in me to communicate anything else on this channel. I'm just gonna try to use all my strength to get home. Like I said, I feel like I'm gonna pass out. I'm so tired, bro. Head is real heavy. It's not really a headache, but it feels like something adjacent to it. But it's just a lot of strain and lack of sleep, I think. So yeah, I could use a meal too, because when you eat as early as I did, I think I had my meal probably like 5 in the morning, so I haven't eaten since. It's like 5:15, whatever I said it was, 5:30 right now. So yeah, I'm lacking a little bit of energy, but I'm hoping this walk will help. Not to mention that the room that we were in didn't have no windows and stuff like that, so you know how big I am on ventilation. If you guys follow me close enough, I try not to go without having at least some ventilation in every room I'm in. So that was a little bit of a mess, being in that room all day long. I'm sure it did not help, but it was worth it, man. I got everything done I need to get done. That is behind me, and now we look forward to the results. So that's pretty much what I got to say. My name is Bdf 44. Thank you all for watching.